viewers, my name is Emmanuel Yeni from RUCOMEF. RUCOMEF, that's Rural Community Medical Outreach and Enlightenment Foundation, is an NGO that is committed to reaching the rural poor of Nigeria with qualitative healthcare. Today we are bringing you a public awareness message on Lassa Fever. With the recurrent outbreak of Lassa Fever in Nigeria, we believe that a well understood message on Lassa Fever will help a lot of us to prevent and avoid being infected. So today we are going to hear from the experts, and we are bringing you this message in different languages, in English language, Hausa language, Yoruba language, and Igbo language. Let's hear from the experts.
My name is Dr. Kunle Olukotun. I'm the director of RUCOMEF. RUCOMEF is a medical NGO that works in rural areas. RUCOMEF is bringing this message to enlighten the public on symptoms and prevention of Lassa fever. Lassa fever is an animal-borne acute viral illness that is endemic in parts of West Africa, including Sierra Leone, Liberia, Guinea, and Nigeria. And an estimated 100,000 to 300,000 infections occur annually. Lassa fever, talking about its transmission. The host is a rodent known as a multi-mammate rat, which often live in and around homes. The rodent is able to excrete the virus in urine and feces for an extended period of time. Transmission to humans actually occur most commonly through ingestion and inhalation through the following routes. Number one, touching of soiled objects, that is objects that have been soiled with the urine and feces of the host. Eating of contaminated food, exposure of open sores or cuts, consumption of the infected multi-mammate rat as a food source, then inhalation of tiny particles in the air that has been contaminated with infected rodent excretion, which are spread during cleaning activities such as sweeping, and then person-to-person transmission occur after exposure to the virus in the blood, in the tissue, secretions, or excretion of an infected person. And it can also occur commonly in healthcare settings where proper personal protective equipments are not worn or are not available. The signs and symptoms of Lassa fever occur 1 to 3 weeks after the patient comes in contact with the virus. And in 80% of infected individuals, the symptoms are mild and often are undiagnosed. And such mild symptoms include slight fever, general malaise, weakness, headache, and so on and so forth. Then in the remaining 20% of cases of infected individuals, the disease may now progress to more serious symptoms such as bleeding in the gums, in the eyes, in the nose, and other orifices. And you could have respiratory distress, repeated vomiting, facial swelling, chest pain, back pain, abdominal pain, and the patient could even come in shock. And you could even have neurological symptoms, for example, hearing loss, tremors, encephalitis, which is an infection of the brain. And death may occur after 2 weeks due to multi-organ failure in about 1% of infected individuals. Lassa fever is treated with a drug, an antiviral drug called ribavirin, which has proven to be very effective, especially when given early in the course of the illness. Then other treatment measures are supportive. You treat the symptoms as they come. Talking about how to prevent Lassa fever. Prevention, just as it said, is better than cure, and this very much applies to Lassa fever. And the following are methods of preventing the disease. One, we need to avoid contacts with the multi-mammate rats. Putting away food in rodent-proof containers is also very important, and we should not eat leftover foods, especially in an environment where rats are common. Then We need to keep the home tidy, clean to discourage rodents from entering the house. There are other methods of preventing Lassa fever or other things we need to do. We should not let garbage and house waste accumulate in the home. We need to avoid the use of rodents as food source. Some people eat rats, so we should avoid eating such. Then use of traps to reduce the rodent population, and then covering of holes and openings around the house to prevent rats from entering. Then if rats die around the house, we should use gloves to dispose them and then burn them off. Then we should avoid the use of newspapers. You know, well, sometimes you go to buy suya, you go to buy akara bean cake, and they use newspapers, old newspapers, to wrap them. So we should avoid use of that, because such might have been contaminated with the urine or feces of the rats where it is stored. And then any sudden illness with fever, body aches, vomiting and cough, such patients should be promptly taken to the hospitals for treatment. Let's not just assume everything is malaria. And then in hospitals, there is a need to use personal protective equipment when caring for infected persons. It can also be prevented in the hospital by isolating infected patients from having contacts with unprotected persons. In conclusion, Lassa fever is a very endemic disease, and it could also be very fatal. So there's a need for us to prevent the spread. So I implore you to kindly share this video with others, and let's join hands together with the government in combating the spread of the disease in Nigeria. Stay safe and healthy. God bless you.